I stumbled across this amazing study that shows the future of what is possible as psychedelic medicine continues to grow. There are two aspects to this study. The first is using group therapy, which makes it accessible to more people and more scalable. And the second is using multiple psychedelic medicines depending on the situation to more successfully treat people depending on their needs. And in this case, it was using either or both MDMA and LSD. Having this greater flexibility to treat more people with group settings, but also tailor each treatment to the unique needs of each individual is how we will help the most people as effectively as possible. In this study, they treated 50 patients, and it was in a group and with either MDMA or LSD over time, depending on what they needed. And these patients either had complex PTSD, they had depression, anxiety, or obsessive compulsive disorder, or some combination. The function of MDMA is to help participants feel safe, begin to connect with the relationship with the therapist and the other members of the group, to look inward and connect to their internal process, as well as to treat trauma. For those who had more limiting internal beliefs or more rigid personality structures, they would use LSD, and they could move back and forth depending on what aspects and what symptoms in the patient's life were emerging. Several therapists were holding space during each group, and there was lots of preparation before each session and lots of integration afterwards as well. Participants reported that they had a lot of healing with the relationships with each other in the groups as well. This study indicates that a majority of the participants did experience a lot of benefit from this form of treatment. However, the study notes that the limitations on the forms of measuring the symptom reduction could be improved upon, and so this is just an indication that this type of more complex study is needed for the future. Groups have been practiced with psychedelics for thousands of years in indigenous cultures. And more recently in ketamine therapy, using groups has been a very positive experience for many participants. And again, similarly, indigenous shamans and healers would tailor the types of medicines they used and how much they gave depending on each unique individual's needs. And similarly in ketamine clinics, we're doing that, although we only have ketamine to work with, but we do use different methods of delivery, different situations given each person's circumstance, and different dosage levels. Being able to tailor each treatment to each individual makes it far more effective because different people need different things. This sort of tailoring seems to be the most effective and really is essential for developing psychedelic therapy to be as effective for as many people as possible. This is an exciting look at the future of psychedelic therapy and how we can make it more effective for more people and also accessible for as many people as possible. Together, we have so much more knowledge. Share your wisdom with the community and comment. Smash that like button. Subscribe if you want more psychedelic therapy content. And may your journey be blessed with guidance, protection, and strength.